Good evening.
Good evening.
Hello, I am Dr. Muhammad, one of the surgical doctor. May I confirm your name and age for me, please?
Hello, doctor. My name is David. I'm 34 years old.
Nice to meet you, Mr. David. Today I will be your doctor. Is that all right?
Yeah, that's okay, doctor.
How can I help you today, Mr. David?
I have this severe pain in the middle of my chest here.
I'm really sorry to hear that, Mr. David. Could you tell me more about this?
What do you mean, doctor? It's a pain here in my chest, in the middle of my chest.
Okay, Mr. David. Could you tell me when this pain started?
Started just 3 hours ago. I thought it's gonna go away, but it's becoming sharper.
Start suddenly or gradually, Mr. David?
Suddenly.
Is it present all the day or come and go?
I just told you 3 hours, doctor. For 3 hours now. It's consistent. It didn't go away.
Okay, I can see. Could you describe this pain, Mr. David?
Sharp pain.
Is there anything increase this pain or decrease this pain?
I don't know. But it's getting worse now.
Okay, Mr. David. Could you score this pain in a scale of 1 to 10, 1 being the lowest pain and 10 being the highest pain? How you could score this pain?
I can say 9. It's a very severe pain.
I'm really sorry to hear that, Mr. David. Okay, Mr. David. Is this pain moved to any side?
Yeah, doctor. It goes to my back.
How about your health being recently?
It's good. Nothing wrong.
Did you notice any unintentional weight loss or general tiredness?
No, I didn't notice, no.
Have you had a trauma in your tummy or your chest, Mr. David?
No.
Have you had a fever?
No, I don't have fever.
Any vomiting or acid test in your mouth?
I used to have GERD, but they gave me omeprazole for it.
Okay, Mr. David. Did you notice any shortness of breath or chest pain?
No.
Can see. Mr. David, did you notice any change in your eye color or your skin?
Yeah, doctor. Yeah, my eyes sometimes they become yellow, and that's quite strange. My wife noticed it, but it returned back again. So it became yellowish and then returned back.
Does the pain increase with fatty meal?
I used to have a pain, yes, when I eat like heavy meal, yes.
Mr. David, did you notice any change in your eye color as being redness or painful?
No redness. Just the yellowish discoloration, as I told you.
I can see. Okay. Is there any change? Is there any pain in your joint?
No pain in my joint, no.
Okay, Mr. David. Is there any change in your bowel habits?
No.
Okay, Mr. David. Did you experience similar symptom in your past?
No.
Were you diagnosed by other medical condition?
Yeah, one of the doctor told me I have what they call it, stones on my gallbladder.
When that happened?
2 months before I experienced this pain, but they said that they're gonna arrange a surgery for me.
Okay. Regarding to your family, is there any one of your family have similar symptom or diagnosed by other medical condition?
No, we don't have similar symptoms.
Do you take any regular medication, Mr. David?
Just omeprazole, as I told you, for my GERD.
Do you have any allergies?
I don't have allergies, no.
Okay, Mr. David. Now I want to ask you a personal question. Is that okay?
Yeah, that's okay, yes.
Could you tell me what do you do for a living?
I'm a teacher.
Who live with you?
My wife and my youngest daughter.
Nice to hear that. Do you smoke, Mr. David?
Yes.
How many cigarettes per day?
Around 5.
Do you drink alcohol, Mr. David?
Yes, occasionally in the weekends.
Could you tell me how many units per week?
Around 10.
Okay, Mr. David. What do you think the cause is?
I'm not sure, but I think it has something to do with the stone that I have.
What is the most thing that you are concerned about?
I just want to relieve this pain, doctor.
Okay, we're gonna help you, Mr. David.
I hope so.
Okay, Mr. David. Did you experience any headache?
No.
Any difficulty in urination?
No.
Now, Mr. David, we have reached our end of questions. You have been so cooperative. Thank you so much.
Thank you, doctor. Okay, doctor.
Thank you.
Can you present your patient, please?
I took clinical history from this gentleman, 34 years old, presented by pain in his tummy, lower part of his chest. The pain is increased gradually. It is associated with fatty meal. The pain is radiated to the lower part of his back.
When did this pain started?
3 hours ago.
Okay, continue.
Okay, the patient didn't experience any symptom suggestive of malignancy. He was diagnosed by gallbladder stone 2 months ago. Also, he has a background of GERD and on omeprazole.
Okay, so from what you're saying now, what's your most appropriate diagnosis?
My main diagnosis is acute pancreatitis.
And what do you think the cause of his acute pancreatitis?
Gallbladder stone.
Gallbladder stone, okay. What are the list of causes of acute pancreatitis? What are the causes for acute pancreatitis? In general.
Stone,
okay.
Alcohol, traumatic injury,
okay.
iatrogenic as ERCB,
okay,
and steroid could be possible cause.
Okay, steroid and hyperlipidemia. How will you investigate this patient?
I will start by request blood investigation to detect serum lipase and serum amylase.
Okay.
Also, I will request serum glucose and liver function test, urea electrolyte, renal function test, and imaging as abdominal ultrasound, CT scan. Also, I will consider ECG to exclude myocardial infarction.
Okay.
And cardiac enzyme.
And cardiac enzyme, okay. What's more specific for acute pancreatitis? Is it lipase or amylase?
Serum lipase.
Why?
Because amylase secreted from different parts of our body.
Yes, okay. Yes, that's the answer. Amylase secreted by different organs. And lipase is more specific toward pancreas.
Yes.
How will you manage this patient?
I will discuss my management with a multidisciplinary team, considering patient MBO, an insert nasogastric tube, an IV cannula for fluid resuscitation, and antibiotic. Also, I will insert a urine catheter to monitor urine output.
Okay. Okay, so you said you're going to give the patient painkillers, right?
Yes, analgesia for the pain, yes.
Okay. Will you consider morphine for this patient?
No.
Why?
Because morphine contracts the sphincter of Oddi, so may increase the pain.
May increase the pain by increasing the inflammation, right?
Yes.
It will make the acute pancreatitis worse. Will you consider morphine for this patient?
No.
Why?
Because morphine can lead to contraction of the sphincter of Oddi, so increase inflammation and pain.
Okay, and what's your alternative?
I will consider bethidine.
Bethidine, okay, that's all. You can go to the next station.
Thank you so much.